The diagnosis of multiple myeloma could be quite challenging, and this is why multiple diagnostic tests are required so that the clinicians can maximize the number of the patients diagnosed accurately. And the latest international guidelines for the diagnosis of multiple myeloma were published by the International Myeloma Working Group, or IMWG, in 2014. This guideline states that an active multiple myeloma is identified in the presence of at least 10% or above bone marrow plasma cells, and these are the cells that secrete the antibodies, or when solitary plasmacytoma is identified. In addition to that, at least one myeloma-defining event needs to be present. The myeloma-defining events are represented by CRAB and SLIM criteria. Starting from the CRAB criteria, these allow the identification of end organ damage. And this is an acronym for C, that stands for calcium, since the patients with multiple myeloma can often develop hypercalcemia, which is increased calcium concentration in the blood. R stands for renal impairment or kidney damage. A stands for anemia, and this is caused by the reduction of hemoglobin in the blood. And B stands for bone lesions that are normally identified by imaging techniques such, for example, radiography, computer tomography, or PET scan. In addition to end organ damage, there are also 3 biomarkers of malignancy, and these are identified as myeloma-defining event. These make up the SLIM criteria, that is defined as 60% or above bone marrow plasma cells, involved uninvolved free light chain ratio equal or above 100, providing that the involved free light chain is equal or above 100 milligrams per liter, and at least one focal lesion on MRI. An accurate diagnosis of multiple myeloma, it is very important since it allows the initiation of an early treatment, and this improves the overall survival of the patient. Therefore, following the guidelines is pivotal in order to maximize the chances of myeloma diagnosis.